respecting Dr. Vishal Rao, Regional Director, Head Neck Surgery Oncology, Dean, HCG Center for Academic Research, Mr. Ravi Kiran, Cluster COO, Dr. Amarnath, Hematologist and BMT Specialist, Dr. VSN Rao, Radiation Oncologist and Medical Head, and respected our Secretary, Commissioner, and DME, and all the officers. To begin with this, I take the opportunity to thank HCG leadership for choosing Andhra Pradesh to provide consultancy services for the important area of cancer care. The subject cancer care is very important today as most of the states governments are embarking their journey towards building a resilient healthcare ecosystem. In the state of Andhra Pradesh, under the dynamic leadership of our Honorable Chief Minister, Sri Y.S. Jagan Mohan Reddy Garu, cancer has been paid utmost attention. If you look into the scenario of Andhra Pradesh state, today I can proudly say that our Jaganana's government is covering up to 400 cancer procedures under Arogyasri, which is a huge number. So we have about 3,255 procedures covering up the Arogyasri scheme. So in that, 400 procedures itself constitute to cancer. That means it's the kind of attention paid by our Jaganana's government is clearly understood. And not only that, and for these procedures, we have incurred up to 1,000 crores, approximately 1,000 crores in this Arogyasri scheme to cover these cancer procedures. And we all know that cancer is the second leading cause of death globally, accounting 1 in 6 deaths, and the death rate is even accounting more in women. So women cancer is the most challenging factor in recent days. So our interest would be definitely working on cancer. At the same time, me as a woman, and my priority would be women cancer, working on women cancer, tracing out and then giving appropriate treatment. And we want to make sure that prevention is better than cure. And also we want to make sure that we want to treat them as early as possible until and unless they go to some different stages and the situation gets worsened. Well, to handle this situation, we aim to build a very comprehensive cancer care ecosystem. Our idea is to create the entire continuum of care, prevention to treatment to palliative and rehab should be received, and it should be covered for every person until the last mile. So you must have heard about the state of Andhra Pradesh. Like we are pretty focused not only in urban areas but rural areas are one of the most concerns, and where we have improved our health systems and infrastructures in order to reach the last mile delivery of treatment to every particular individual at the grassroots level. In my recent visit to Varanasi to celebrate Universal Health Coverage Day organized by the Government of India, I've got the opportunity to discuss more on this cancer with our Honorable Union Minister to consider and sanction comprehensive healthcare centers, as many as possible in the state, because after the state have been bifurcated and we were left out with the 13 districts, and as per our leaders' recent reorganization structured pattern, so we constitute up to 26 districts in the state. So as my leader Jaganana is dreaming about 17 upcoming medical colleges in the state, and also along with the 11 existing medical colleges, so we also look forward to setting up an establishment of comprehensive cancer center, at least one in the new district. So we have requested the Honorable Union Minister to kindly consider this and probably help us out in setting up these cancer care centers in the state, as many as possible. And we definitely need expert helping hands like you, and to work hand in hand and understand the needs and understand the critical care which is needed, especially in regards to cancer, and to strengthen the cancer care ecosystem in the state. My office will be available to you anytime, and of course you must have definitely you've been in touch with our Secretary Naveen and Vinod, as well my Commissioner Nivas. So they're all very hand-in-hand persons where you can definitely reach at any given point of time. And if I have to say something about Naveen, and he doesn't hesitate to come to you even and to understand more and how we move forward with the steps, and how we, both of us, HCG and Government of Andhra Pradesh, can work together in making this more effective in the state. As well, not only this, and the scope of the MoU, I think this HCG shall provide consultancy services to the second party for the operations of the second party, or maybe on the oncology department. So cancer screening and preventive oncology, nurses training in the district hospitals, training of dental health officers at all district hospitals to screen head and neck and oral cancers, and Pharma D oncology training, training of Pharma D candidates in oncology, rehabilitation, which is like training of alternative medicine doctors, nutrition training, and also yoga is also been offered, I believe, and hands-on training for surgeons, collaborate with Global Healthcare Academy on hands-on training for the surgeons, advising in setting up of 50 bedded oncology hospitals, handholding on all aspects of such setuping of 50 bedded oncology unit, asset and inventory requirement advice, health screening, 30 outreach camps in various district hospitals in a month, regular health tasks at district hospital levels, and collaborate with the state level hospitals. Thank you, HCG, for making a partnership with the Government of Andhra Pradesh. Thank you so much.
Thank you.